Failing to timely enroll in your Medicare plan is a costly error that can result in lifelong penalties and/or denial of your application for coverage. Enrolling in Medicare Part B too early can cost you thousands of dollars in premiums for coverage you cannot use. So here is what you need to know. If you are drawing Social Security benefits at least 4 months before you turn 65, your Medicare enrollment for Part A hospital and Part B medical should happen automatically, and you should receive your card before your birthday month. If you are not receiving Social Security benefits when you turn 65 and are not covered under a large group health plan, you must take action to enroll. You can visit your local Social Security office or save time by enrolling in Medicare on ssa.gov/benefits/Medicare. If you need assistance enrolling, you can call our office at 1-800-462-3980. There is a 7-month initial enrollment period when you turn 65. This enrollment window begins 3 months before your birthday month and ends 3 months after. Enrollment in Medicare consists of 3 different insurance plans or Medicare Advantage. Part A covers inpatient hospital care, skilled nursing, not to be confused with nursing home coverage, hospice care, and some home health care. Part B covers outpatient care, medical supplies, doctors and surgeons, and preventative care. Part C covers Medicare Parts A and B, and sometimes Part D and one plan also called Medicare Advantage, not the same as a Medigap policy. Failure to sign up within the enrollment period can result in a penalty 10% per year for Part B and 12% per year on Part D, being added to your premium for each year you were not enrolled after becoming eligible. An example, Fred turned 65 in July, is no longer working, and has not yet drawn any Social Security benefits. Fred wants to be proactive and enrolls in Medicare. He has a 7-month enrollment window from April 1st through October 31st. Fred contacts Medicare Gurus in May so his coverage can begin the first day of the month he turns 65. A qualified Medicare specialist assists Fred in signing up for Medicare and enrolling in a Medicare Part D drug plan and a Medigap insurance policy. Fred also elects to purchase a cancer insurance policy and a dental, vision, and hearing plan. Each year, there is an annual election period, which runs from October 15th through December 7th. During this time, Medicare beneficiaries have the opportunity to make changes to their Medicare coverage. They may switch from Original Medicare to Medicare Advantage, or from Medicare Advantage to Original Medicare. They may also change their Medicare Part D plan. There is no limit on how many times they can make changes during this period. If after selecting a new Medicare Advantage plan during the annual enrollment period, you are unhappy with it, all is not lost. You will have another opportunity to switch your plan during the Medicare Advantage open enrollment period. The Medicare Advantage open enrollment period runs from January 1st through March 31st. Under the new rule established in 2018, the Medicare Advantage open enrollment period was extended to March 31st. The new rule also allows you to switch to another MA plan or Medicare Advantage plan. Any changes will go into effect on the first day of the month after you enroll. The Medicare Advantage open enrollment period is the time when you can change to another Medicare Advantage plan or back to Original Medicare with or without a Part D prescription drug plan. Medigap insurance does not have to be changed during the annual election period. You can apply to change Medigap plans at any time. However, you must be medically underwritten unless you are in the initial enrollment period or qualified for a special enrollment period, which will be discussed further in a moment. If Fred had missed his initial enrollment period of the 7-month window mentioned before, he must wait until the general enrollment period for Part B medical and the annual election period for Part D. For Medicare Part B medical, Fred's enrollment would be delayed until the next general enrollment period. The general enrollment period runs from January 1st through March 31st each year, and the coverage would begin on the following July 1st. His Part B premium would have a penalty for life equal to 10% of the Part B premium for each year he went without the coverage but was entitled to it. For Medicare Part D prescriptions, Fred's enrollment is delayed until the next annual election period, which runs from October 15th through December 7th for a January 1st effective date. Fred's premium would be penalized 1% for every month he was entitled to the coverage but did not have it. The penalty is permanent. Late enrollment in Part A hospital can be done any time after you turn 65, and there is no penalty for those who get it free. Medicare Part A does not have a premium if the beneficiary or their spouse paid employment taxes during the years leading up to Medicare. People who are required to pay a premium for Part A will have a 10% penalty. The penalty is not permanent. It would last for twice the number of years the beneficiary was eligible for Part A but did not have it. Special enrollment periods allow beneficiaries to enroll without a penalty. The following are some common examples that qualify you for special enrollment. Example, Fred was covered under a large group plan, which was his primary coverage. He leaves his job and loses his coverage effective January 1. He has 8 months to sign up on Medicare Parts A and B, 2 months to sign up on Part D, and 63 days to apply for Medigap policy without answering health questions. Note, if Fred delayed enrollment in his Medicare Part B because he had primary coverage through a group plan, he preserved his 6-month open enrollment period for Medigap. This gives him 6 months instead of 63 days to enroll in a Medigap plan without answering health questions. Fred was covered by a Medicare Advantage plan or a Part D prescription plan and moved out of the plan's service area. Fred has 2 months to enroll in another Medicare Advantage plan, Part D plan, or return to original Medicare and enroll in a Medigap policy without having to answer health questions. The 2 months begin the date of the move or the date he notifies his plan of the move if later. Fred is living in a long-term care facility. Fred can enroll in a new Medicare Advantage plan or Part D plan every month. Fred qualifies for extra help from Medicare prescription drug coverage or has Medicaid. He can switch his Medicare prescription drug plan or Medicare Advantage plan once per quarter, but is not entitled to enroll in a Medigap policy without answering health questions.